Welcome to another edition of EdTalks. And I'm thrilled today to have my friend, Dr. Sarah Matt, join us. Welcome to EdTalks.
Thanks so much, Ed. It's exciting to be here today.
No, I'm super excited to talk to you. You have an amazing background. You are a surgeon turned tech turned truth teller. And so tell us a little bit about that. Break it down for us. Tell us about who you are.
Yeah. I think a lot of folks decide to go into tech straight away. A lot of folks go into medicine first when you think about the tech world, especially in startups. I started off 100% clinical as a surgeon, but decided really early that I really wanted to scale myself. And the bedside was actually rather confining. How could I actually take care of hundreds, thousands, or impact millions of people every day? And going into the tech sector was actually the way to do that. So my whole career has really been focused on product management and strategy. And I've done that at a lot of great places, small and large, everything from small startups to Oracle at hyperscale. And I've got to do a lot of great things that have impacted millions, if not billions of people, which has been wonderful.
Yeah, that's really cool. Do you ever miss doing surgery? Like, do you ever want to scrub in and get
So I'd say that for surgery, do I miss surgery? No. It's a volume practice and you have to be really dedicated and do lots and lots of surgeries to be great at it. But I still love patients. So I still do charity care out here in upstate New York. I was just at the clinic yesterday. And what I'd say is that I'm not the best doctor 7 days a week, but when I get to do it once a week or a couple times a month, I'm amazing. And I get to spend time with patients and really keep me grounded because I think a lot of us forget that patients are not necessarily living the same lives that we do. And there's so much difficulty going on right now. And there's ways that we can help.
Yeah. No, that's great. That's what I love about you. And you have this fantastic background, as you were describing, both the clinical training and practice, and then mixing that with tech. And then it's given you a great understanding and worldview. And then you bring all that to bear in your own unique way. And one of the unique ways that you're bringing that to the forefront and actualizing all those skills and experience is you're writing your own book. So I'm super excited about the book. Tell us about your book.
Yes. So it's coming out November 26th. It's called The Borderless Healthcare Revolution, the definitive guide to breaking geographic barriers through technology. And I'm really aiming this book at two different big groups. So leaders in healthcare. And when I say leaders, I don't just mean board members and CEOs and C-suite. I mean line leaders. I mean nurses in charge of a floor, because ultimately you can lead from where you are and there's a lot you can do for patients at all those levels. But then I'm also really thinking about the builders. Part of my secret sauce has been building all these years for what patients, providers, systems really need. And so every single chapter is really focused on those two areas. How can we help people boots on the ground in a healthcare facility and in a system? But how can we help the folks that are building today that may not come from healthcare, but come from great tech backgrounds or business backgrounds, and help them understand the space so they can ultimately build and create things that are actually going to impact patients, providers, and our healthcare system in a really positive fashion.
Yeah. And so, in terms of access, talk about some of the ideas in the book that a leader could grasp. So like you mentioned, you sort of bifurcate two broad audiences, but on the leadership part in healthcare, what are some things that can be done?
So I think that a lot of folks get really excited today about AI this or automation that, and they're really focused on the tool, on the technology, on that shiny object, trying to figure out how we can absolutely use AI today. And I think what happens is that we forget that these are still tools. We need to figure out what problem we're trying to solve. And so whether you're a builder creating or you're a leader on an award or a line, or you're building an entire business around this, what problem are you solving that's urgent and pervasive for providers, for patients? Is AI the right tool for that? Is automation the right tool for that? Is AR the right tool for that? And I think oftentimes we think, how can I shove this technology into the space as opposed to how can I solve this problem best?
Yeah, I love it. And you really brought out two really important things. One is that no matter what kind of leader you are, you're a leader and you can make change. Because
Yes.
as you know, Sarah, and you've worked in health systems and big companies, a lot of times people believe that the only persons who can make a difference is the CEO or a board member or something like that. But you can really make a difference at all levels. Can you break that down one more level in terms of encouragement for someone who might be listening, thinking, well, I'm just a department head or I'm just a charge nurse or what have you?
So I think that we forget that our most powerful folks in the field are the ones that are touching our healthcare customers patients every day. They ultimately are in charge of that customer relationship. So when you are showing a customer, your patient, that you care about their cultural identity, you care about their digital literacy, you care about their actual circumstances that may prevent them from being compliant or prevent them from being able to utilize the system well, you recognize their problems, you validate them, and therefore those clients, those patients will trust more. They'll
Yeah.
gain more knowledge and they'll want to return to your office, your system, your hospital more. And in the marketplace today, especially in the United States, every large health system is ultimately just desperately trying to build market share at the borders of its geography and of its market against the next one. And so when we think about retaining our customers, our patients, that trust is vitally important. The technology piece, it's the easy part. The
Yeah.
trust, the acceptance, and actually adopting it so people use it, that's the hard part.
Yeah. And you just brought out another key point, and that is, we're talking about it. You and I, we're coming from sort of this empathetic point of view and care about the patients and delivering, highest quality care to everyone, have the access available to anyone, regardless of ability to pay and those sort of things. But you also just brought out the fact from a strategic lens, and I know you've worked as a leader in strategy for some of these companies, that you can make an impact in market share. I mean, so if you're taking this from a revenue
Yes.
point of view, doing this is good for business as well.
Yes. And I think that's important. I think that a lot of times folks think of this really at the edges. Oh, it's either charity or it's cutthroat business, and there's nowhere in between. But healthcare is a business. And we have to recognize that when we think about how things are going to be reimbursed, how things will be dealt with by Medicare, Medicaid, these are constraints on our healthcare system business. How can we utilize those constraints to our advantage to provide better, more quality care for our patients who are ultimately our customers? And access and bringing in different kinds of populations to your market is good for business. I have lots of great colleagues in the clinical trial space, and I know there's new FDA regulations and such that have asked us to increase the different kinds of people we have in clinical trials, as an example. It's actually good for business. Now I have access to these new markets where I can utilize my therapeutics within different kinds of people, different demographics. I have just doubled my market share
Yeah.
because I've had now access to these folks by starting from the beginning and considering how we're going to approach the market differently. So instead of adding buzzwords to the mix, thinking about access and thinking about the folks who now can take advantage of what we're providing and increasing that, it increases your TAM, it increases your potential of revenue, and it increases the things you can do within your system.
Yeah. It just makes so much sense. You'd find a hard reason not to do anything that you talked about. And that's why I can't wait to see the book and read it myself. I think it's going to be packed full of great wisdom. We just obviously scratched the surface. Sarah, people are going to want to get a hold of you. And I know you do more than just write. Tell us a little bit more about some of the other things that you do, because I know you speak as well. And how do
I
we get a
do.
hold?
Yeah, so I think the best place to go is check me out on LinkedIn or go to drsarahmatt.com. All my information's there. I'd love to chat. I have a lot of great things I do. I advise startups. I work with several VCs as their mentors, and I do a lot of great work from a consulting perspective too. But really what I love to do is spread the message of improving access, utilizing technology in the best ways. And I have so much great experience I'd love to share with folks. So I do a lot of mentorship from students. I mentor students from the MBA program at Macombs, where I'm an alum, to upstate medical students where I teach, and ultimately business professionals all over the place, because there's no reason someone should make the same mistakes that I have.
Yeah, no, I love that. And that's what's so unique about you. You have this 360-degree view. You a clinician, still active, surgeon. You've worked in big corporations. You've helped small companies and startups. You have the heart, for the patient. You know the business side. It's truly full rounded. So I will post in the show notes links to your website that you mentioned and your LinkedIn profile as well. Dr. Sarah Matt, thank you so much for being a guest on EdTalks.